Hello, everybody. Welcome to episode 231.
There you go.
We just did 230.
That's right.
231. We're having a great talk about the United States being a prom queen. It's funny. And we've got Chris, Kobe, is it blue?
It's a little blue on the top, yeah.
Silver-haired fox, study coordinator. We've got James, who's generously offered to pan this camera around because no videographer's here today. Thank you, James. How's it going?
I'm alright.
If you want to hear James, it's episode 230. Just go back one. You hear James's story. We're going to get him involved too because he's got a lot of stuff to talk about. You know what? You guys were in the same class.
Yeah, I know. That we were talking about that
Oh,
earlier,
okay.
too.
So you know each other?
The final.
Yeah.
You took the final.
Kobe took the final?
I got like a
There
90
is.
like a 90 on there.
Okay, good.
You got a 90?
Yeah. Or
That
like,
might be the high score.
or something.
Yeah?
I got like -7 or something.
Wow. Okay.
Out of like 60.
Hey, don't tempt me. I can log in right now. Look.
Go ahead. Please tell me my
We
exact
should.
score. I'll call you. Go ahead.
No, Kobe knows his stuff. Actually, that's what we're going to talk about.
Okay, cool.
Like, so people have seen our first interview
Oh, with Jesse.
with Jesse.
Yeah.
Yeah, when you were still interning.
Mm-hmm.
So now, 2019, you are
New year.
new year, new you.
New year, new
You
me,
got
new hair.
silver hair.
I actually
You've
got
got
a job.
study coordinator. You got a job. J-O-B.
J-O-B. Mm-hmm.
What do you think so far? Like, it's the same thing as what you're doing, except
Mm-hmm.
you're getting paid now.
Yeah, no,
Yeah?
no, yeah.
Or you're doing more. You actually have more responsibilities, though, too.
I do, but
Yeah.
I mean, everything is the same. You just have to learn how to just learn how to split your time up evenly. Time management. I have access to like all the EDCs, all the RTSMs, all the systems that you are expected to work with.
Yeah.
I mean, I'm just Monica's starting to log me in with it or have me get access to it. So.
And she's starting to have you do, like, more and more stuff, too.
Oh, of course, yeah.
Yeah.
Because before she would basically like hold my hand like through everything.
Yeah.
Now she's doing one thing, I'm doing the other thing.
And now you're doing rating
which is-
scales. You're putting your masters to work.
I'm excited about the rating scales, honestly, because I mean,
I think so, too, because when I first interviewed you, like, it wasn't really an interview. We knew you were going to intern here.
Mhm.
But, like, I told you, remember? I said your master's
yeah,
degree.
that's what drew you to me.
Yeah.
Yeah.
There's, like, it's in psych.
Yeah, no, you
What
don't.
is your degree again?
Clinical psychology.
Yeah, see?
Yeah.
Masters. Like,
Nice.
Yeah.
you can do almost any rating scale except MD stuff,
Right.
Yeah.
which kind of do every now and then anyways, right?
Just
Before
brush
Kellogg
up.
does it.
Yeah, just brush it up. Yeah.
Yeah, so, you know.
My goal is to be better than this guy at all the rating scales.
This
Is
guy
it
can do
wise
it.
to say this?
Yeah, because Kellogg actually does it. It's just
Yeah.
Kobe, like, preps him for it.
Yeah.
Oh, okay.
Yeah. But you're good. You're good at that
Well,
stuff.
thank you. I mean,
So
I
what?
hope-
Which one? What's been the most challenging?
the ratings?
Yeah.
Probably the skid or the mini. I mean, you have to be thorough on them and.
And you've done the
They're just-
trainings for all those too.
Yeah, all the trainings for them. Yeah, you just have to be thorough with some of them, and then the criteria is
Look at that. Masters of Psychology.
yeah. Yeah, there's all the different criteria. So I mean, it's challenging, but I mean it's fun. I find it fun. So
So the rating stuff is what you find most interesting so
Yeah.
far?
well, I mean everything, but I mean if I had to pick one thing,
Yeah.
I like the rating.
Yeah?
That's where you actually get to discern. Okay, are they schizoaffective? Are they schizo? Are they just depressed, or was it just a relapse, or what was it?
And what have you noticed from the patients? Like, we don't have that many, but we have a good amount. But it's good because you get to know them, right?
Oh,
Like
yeah.
you get to see them after a while.
Oh yeah, like on a friend basis or just client basis. Yeah.
We have one patient, by the way, who like loves Kobe. He's like, you got to have this guy on a billboard in front of the building.
Have I met this patient?
No, he came
No.
yesterday, right? Was that yesterday?
That was like Wednesday.
No, get closer to the mic.
Wednesday.
Not yesterday, right?
No, that was Wednesday.
Oh, yesterday was monitor. We'll talk about
yesterday
that
was
too.
monitor.
We'll talk about that without
Okay.
mentioning studies,
Of course.
how that went. But let's so patients, like, they like you. Patients love this guy. Seriously.
Yeah.
Good.
I mean, well, like my previous jobs, it was always face-to-face interaction. Or
Yeah, that's
whether-
all you were doing, right?
Yeah, whether it was with kids or parents or just third parties or whatever.
Were you doing rating scales there too? But like, they weren't called rating scales. They're called like something else or what?
They weren't rating scales because I'd go in and know their diagnosis or their condition or whatever, and I would just base my plan off of that or the sessions off of that. So,
Okay.
Kind of like a live rating session, like
Yeah.
because you'd always have to adjust what you're doing. So like maybe they said that you're having problems with this, but
Yeah.
when you initially get there, you're like, okay,
Yeah.
from my judgment or my expertise, they're fine with that.
Yeah.
And now we can move on to something else.
But here the PI does the skid and mini, but you do it like the pre-screen.
Basically, yeah.
So when you were talking about doing those things, it's for pre-screening,
Mhm.
and then the
Pre-screening
PI does
purposes,
it.
yeah.
And then we got another nurse practitioner who we just talked to, who's, by the way,
Mhm.
James. He said he's gonna start on Mondays now.
Good.
So
I can
we're
meet
gonna
him.
have him. Yeah,
Nice.
yeah. You can teach him how to do this stuff.
That's gonna be really cool, even though I don't know what I'm doing.
So okay, so now the monitors. You know what happened here yesterday, Chris? I got
no
pissed.
clue.
I didn't get pissed, but I was like, what the hell, man? You guys are and you're new, so you and so is Monica in a way. You guys are like so nice with the monitors.
Mhm.
When I just came back from UC San Francisco,
Mhm.
like you're treated as a CRA.
Uh-huh.
You're treated like crap, right? You're thrown in a dungeon, and you're like, if you need me, email me. I'm most likely not gonna be here. That's literally what they say. So I'm like, all right, like I'm pretty much on my own. You know, the monitors here today. This is why I say private
Just leave
sites
'em.
so much better than universities.
Mhm.
And that's the university I monitor. They're actually good.
Mhm.
They're actually good. But small sites, like you get the personal touch. Like here, we bought lunch for the monitors.
Mhm.
Lunch. And here's the kicker. She spent like the whole visit with them in the room. Like
Why?
side by side.
Why?
No,
Going through all the stuff,
not
right?
for the most recent one.
The one yesterday.
No,
No?
no.
Oh,
That
okay.
was Monday, Tuesday. Monday, Tuesday was a 2-day one.
Oh, you had two monitors today for 3 days,
Yeah.
right?
Yeah, the first one was for 2 days, and the recent one was only 1 day.
And
Only-
you guys
only like
sat
3
with
hours.
them the whole
No,
time?
no, not the first one.
Oh, okay.
No, the first one that we if you need anything, let us know. We're doing our thing.
No, but yesterday. You guys
Yesterday.
were with her all day.
It took like 2 hours. 2
Okay,
hours because
alright.
we only had one enrolled patient, and the rest
Yeah.
were just screen.
Normally, I wouldn't even have noticed because, like, that's how I would assume
Really?
it should be, anyways. But after my recent experience on the other side as a CRA, I'm like, we're spoiling these CRAs that come here. But I get why, because it was the first IMV.
Yeah.
The monitor's learning, we're learning. They're making sure everyone's on the same page.
That monitor is really cool, though. She's really, really cool.
Now you're gonna see
Yeah.
them on next week
She's very, very
or
cool.
2 weeks.
Okay.
Same one.
Right.
So what do you learn from the monitors? That you don't want to be a monitor?
Not that I don't want to be a
Like
monitor.
James.
Just,
James wants to be a monitor.
well, yeah, and that's what we were talking about earlier before.
If you're ever a monitor, spend the whole day with your coordinator in the room.
Yeah.
Just go through, have
Most
them do your report.
Most coordinators are not going to do that.
Have them do your report for you.
Here,
Did you guys do their report?
No, we didn't do anything.
And if there's an inside joke there, Dan has actually had this happen.
Oh no, I told Kobe about that
Yeah, but
yesterday.
The recording doesn't know this.
Oh.
The listener doesn't know this.
There's a story, yeah. So this site selection visit a couple years ago was just me and Monica, and this CRA came in for a study. It was a site selection visit, and you could tell he was like had a million things going on. He just landed. He had to do our SSV and then go somewhere else and do another
Overworked as most CRAs are.
one. Yeah, like just no
Nothing
control of his time, like nothing, just all over the place. Nice, friendly, and he's like, he didn't know I'm a monitor.
Yeah.
He just thought I'm someone at the site,
Yeah.
but he didn't know I double dip as a monitor. So he's like, hey, you know, can you guys? It would be so helpful if you guys just filled out this form for me. So he emailed me the form.
The report form.
And it turned out it was his SSV report template. But he didn't know that I knew what that is, because remember what I told you? Sites don't see those things, ever. Like, how long have you been doing research? You've never seen a monitoring report until recently,
Yeah.
when we
So,
started getting into it.
Maybe a year ago.
So, like,
Yeah.
9 years, you have never seen one.
That's
So,
right.
if you have never seen one, and someone sends you one, you're just going to assume
Well,
this
it's
is like...
very similar to the follow-up letter, so you could put two and two together.
You could, but you would just assume this is their form they use to select
Sure.
sites.
Sure.
you wouldn't know that that's like what they get
Their
paid
checkbox,
for.
Yeah.
So he gave me this form to do. He said, just email me when you're done.
Okay.
And, so I did. I obviously put, do you recommend the site? I put, yes, absolutely.
The
Site's
best out
fantastic.
there.
Yeah. And then I'm like, here you go. And he's like, thank you. And then he submitted it. We didn't get that study, but not because of that. There was another issue. Monica mentioned.
Like
one.
reimbursement or something. Come on, man. I did your
know.
job.
I should have told him I'm a CRA, but I wanted to get that study.
Yeah.
So I was like trying to be like cool.
Just play it off cool. Yeah.
Yeah.
Whatever, man. Yeah.
Take no qualms with filling those out for our sites.
Yeah.
Yeah, I wish every monitor did
just
that.
give it to us. We'll take
Give
care
it
of
to
your
us.
job for
We'll
you.
finish your visit for you.
That's right.
Your IMV too.
Yeah. No issue.
Yeah.
You get paid, and we're happy.
All right. We have it on record now. So.
Chris has a story of a monitor. Tell him the story of the monitor that came to breakthrough and was lazy and like didn't do anything, like multiple trips in a row.
Yeah, I told you this story already. But so we had this depression study.
Mm-hmm.
Ton of patients in it. We had like 20, 25 patients in
Okay.
it, right?
Just coming in now.
So a lot of data to review.
Yeah.
I mean, it was 5 days worth of data.
Okay. At least.
And the CRA comes in, his very first visit, he comes in, he stays an hour
Mm-hmm.
and leaves. And he says, I'm done. I'm out of here. I was like,
Did
all
you
right.
do anything?
No. What are you going to get done in an hour? So next time
Yeah.
he comes back,
With a lot of data too.
At least
ton
20
of data.
patients. Yeah.
Ton of data. Next time he comes back, he asks for the site signature log,
Mm-hmm.
right? So, which I know Dan says he does this first too.
Well, to put in perspective, the amount of data he had for a typical visit is less than what I had for my recent trip to the Bay.
Right,
And I spent 8 to 6, no lunch,
right,
in the room.
right. Exactly, right.
And barely, didn't even truly finish. I
No,
rushed at the end.
This is 5 days of work.
Mm-hmm.
Yeah.
So he comes, he asks for the site signature log. It's like, okay, so I sign off, countersign what he's put down.
Mm-hmm.
And 20, 30 minutes later, okay, I'm done. Right? And I was like, oh.
Hold on.
Yeah, basically. There's no way you got through all that work.
He's superhuman.
What's going on?
Yeah.
Right? And he kind of laughs. He goes, well, you see, I went to school here. I went to UCLA.
Okay.
Right? And now I live out in the East Coast.
Mm-hmm.
So I'm just kicking it with my friends.
At least he was straight up about
Yeah.
it.
Well, because Chris is cool, so people want to talk to him.
Really?
I try to ignore our monitors when they're here because I don't want to be bothered. But if I like them, I'll talk to them. But Chris talks to all of them.
Yeah.
Okay.
Yeah. And it was the last time I saw him.
He was just kicking it with his friends. So.
Somebody said something. I'm sure he got fired.
Yeah.
We weren't the only site this was happening.
Dang.
Wow.
Yeah, because sometimes the sites will actually complain. We're joking about it. It's, we wish we had that.
Mhm.
But sometimes it impacts your payments.
Oh yeah.
Not only that,
Because
but
if they're not reviewing your stuff, then you're not getting paid for that.
Yeah, because what's showing that you're doing your work, right?
it
Right.
goes even a step further than that, though.
Well,
in
to
my
me, that's the
opinion.
bottom line.
Well, of course, that's very important, without a doubt. But they're also kind of your what's the word I'm looking for? Your cushion between your site and the FDA, right? Your
safety
security
net.
blanket, right? Your
Yeah,
safety net.
Yeah.
Because they're reviewing your work to
Mhm.
make sure it's going to pass any FDA inspection.
Yeah.
That's their function. That's their job,
Basically.
right? So if they're not doing that, you're at risk.
How do you know you're doing your job
Right.
correctly?
You have no, if this guy was our monitor for the entire study, we would have no clue what's going to happen in FDA. audit,
Yeah, what if
right?
you were screwing up?
Which I'm sure we were. I mean, every site does a little bit somewhere.
Yeah.
Well,
right?
our first study when we just got started, I mean, the monitors caught it. They're
Yeah.
doing their job.
Yeah.
If we had this monitor, we would have kept doing that.
Yeah,
Yep.
and
Right.
we would have been in a bigger hole.
Yeah,
Well,
and
we
if
could
the
have
FDA,
done.
and if
Yeah.
the FDA shows up knocking on the door,
Oh yeah.
you got problems.
No note to
yeah.
files, none of
Nothing.
the stuff we did to remedy
To
it.
amend,
Yeah.
Yeah.
Like the corrective action that we talked about yesterday with
yeah.
the
Kappa plan.
yeah.
Oh yeah.
So monitors are actually your friends.
Yeah, no. Yeah, I see them
Sites
as the
friends.
friends. It's just
Yeah.
the sheer amount of work that they have to go through.
I was just jealous because I was like, damn, the site, we're so nice of them.
Well, I mean,
And I could treat it like crap where I go. They're nice, but they're go in your room and that's it. If you need us, just maybe pray.
Sounds like a personal problem.
Yeah, it does. I can't complain. It's good. It's good. Good contract position.
That's
You'll
excellent.
be monitoring very soon
Well, it's
with
supposed to
James.
go-
With
It's
James.
supposed to go in 2 weeks, but thankfully you got me out of it.
The CROs get blacklisted, like people like the
That's a good question.
Hmm.
You know,
I don't know the answer because I think every company's different.
I would say yes, they can. So if the
I
FDA
think so,
audits,
too.
they can certainly blacklist a PI. They certainly can blacklist a coordinator, a site. Why not a CRA?
I've seen CRAs blacklisted by the FDA, but you have to do something very bad for that. I think James is asking about like if a CRO, like this CRA example,
right?
you know, will they announce to the other CROs like,
No, that's a lawsuit, right?
yeah. So the unfortunate thing is like he's probably got a better job now. Like, and he's probably learned how to like do a little
Disguise his
this
actions.
guy, yeah,
Just to
like
get
work a
behind.
little more
Yeah.
and still like,
Sneak by.
yeah,
Yeah.
yeah.
You know.
Human nature, the path of least resistance. What
Yeah,
we
you
talked
like
about. Yeah, I think I heard it on Jordan Peterson.
Yeah.
Makes
Jordan
me sound
Peterson.
smart. Yeah.
It makes me sound smart. Jordan Peterson.
You
is
heard him?
killing-
Jordan
I
Peterson?
listen to him like every night.
Really?
Yeah.
Make your bed.
No.
That's what he says.
Yeah, I know, but why? Why now?
True. No, I'm just saying that's his
No,
answer for
that's
everything.
That's like his slogan. Yeah.
do you
You
listen
like
to him?
lobsters?
Lobster. You didn't listen to Jordan Peterson? You should.
Have you heard of him?
YouTube
No.
him next.
It's okay if you haven't.
No,
A lot of
it's
people haven't.
I just like how he always can come in with like a level head, and even when
Yeah.
he's confronted with like
He's being
Like a half a dozen
attacked.
people attacking
yeah,
him.
he's
Like
still
you-
like, okay, let's break
I'll
this
show
down
you after
scientifically or
Jordan
intellectually.
Peterson.
I've only
He's
seen
cool.
him get
He's
truly
cool.
mad one time.
I'm not like a huge
Probably like a
fan,
one-on-one
but
interview.
The one time I
yeah,
saw him
he's
truly
cool.
get pissed.
Like I don't agree with
was-
everything, but I like his style.
Dan, who was that guy he was debating on stage? It was Jordan Peterson and a comedian, and it was the two leftists.
That
Female-
sounds like every video of his.
No, it was a female, and he really got pissed. Jordan Peterson on stage, like, yeah.
what topics does he?
I think that was Ben Shapiro.
About anything,
No,
everything.
it was on stage in
mostly
front
like
of like
political and like
5,000
tying it
people.
in with society and how
It was
the
God, I
younger
can't remember what it was
generation
called.
men have to
He was
just
asked.
take responsibility.
I can't
and
remember
grow
what it was
up.
called.
But I didn't know. That's surprising, man. I didn't know you listened to Jordan Peterson.
Oh,
That's
yeah.
cool.
Yeah.
Yeah.
I mean,
Good stuff.
yeah, it is. It's inspiring. Well, it's not inspiring. It puts everything into a different perspective, and it allows you to either take what you want from
Yeah.
it or just keep going on about your life or whatever you want to do with it.
I just discovered him like a few months ago, like late, maybe second half of last year.
Yeah.
Because of Joe, I think he was on Joe Rogan.
Yeah, because I watch Joe Rogan all the time.
Yeah, I
too.
watch Joe Rogan too.
He just had the Tyson one or something.
I missed that one. I need to hear it.
that's
And then
good.
he's gonna interview Kanye next.
I know, which is
The internet's gonna explode. Joe Rogan. You watch Joe Rogan?
Yeah, I know about
He's gonna interview Kanye West. The internet's gonna go nuts with
Yeah.
that one.
Here, I just remembered his name.
Yeah.
Right here.
Oh, this guy.
Watch this. No, not that him. But watch this.
Okay.
And when this guy right here,
He just gets into him. Just
yeah, right here, when he says this,
wow.
it really pisses him off.
Huh. Because I want to see him. Because like people come at him and they try and dig
Yeah.
at him too.
Yeah.
And he's just like, okay, that's your opinion. I don't
He
care.
plays it off like, you know.
I don't even think it's a playoff. He just understands like this is what you think. That's cool.
He
This is-
doesn't
I'm
get
gonna go my
emotional.
way.
Right.
Like,
He doesn't get emotional.
Yeah.
It's, that's a good strategy. Like he's a good dude. So what else? What Kobe? What are your goals for this year?
for this year,
Yeah.
all the rating scales, get them down. I guess not perfectly, but as best as I can. Just good understanding of it. Whether it's something I can do or just the pre-screening process for the PIs or something.
Mm-hmm.
I think one of my bigger goals is to maybe establish like maybe a business plan for a site, because I mean ever since you implanted that in my head, it's been just recurring. Maybe specializing in a particular subject, maybe autism, because I had that. I was a behavioral therapist and a supervisor therapist, so I have decent experience with that. In terms of clinical research goals,
you're gonna co-monitor with me.
Yeah.
Did I tell you?
Yeah.
He's
Oh, yeah, you
gonna
told me.
lift me over.
Yeah.
There's a site that's like a 2.5 hour drive,
Mm-hmm.
and we're gonna do podcasts in the car with your GoPro.
Oh, of course.
Which is, I gotta buy that cable for your camera.
So do you have inroads to autistic patients?
Inroads. I still have like connections and with the companies and everything.
Because I see a number of autistic studies.
Yeah.
I just always turn them down because we don't have any way of getting those patients.
If it's adolescent studies, yeah, most better than adults. Because I
Yeah.
mean, I generally handled adolescents and young
Alright.
children. But I
So
mean, that's
remember
always
that next
We're
time I
doing
see one.
business on 231. Episode 231. That's good.
but that's always a cautious road because it's the kid. I mean,
Yeah.
we have to ask with the parents.
You have to have
and
the
everything.
parents'
Yeah.
permission. Yeah.
But I mean, all the parents or like clients I've interacted with, I've left on good terms. Everything they all remember me. I still visit them sometimes today. So I mean,
And for
Yeah.
that study, if we were to get it, you can do like the outreach, community
oh,
outreach.
of course. Because I mean, I still talk to the CEO of my last company.
Oh yeah.
Yeah, I mean, just hey, what's up? How's it going?
Okay.
Just like on a friend basis. But
What do they do? I never knew what they did.
with the
Those guys.
companies?
Yeah. What
Like
kind
the
of
ABA
company was
companies?
that? Yeah, where you worked at before here.
yeah, an ABA company. That's just a behavioral analysis basically. So it's just like a typical business. They'll run the admin side. They'll get their clients however they built up their database or client base. They'll hire
So it's behavioral health and treatment center, like an outpatient clinic for.
basically.
Okay.
Because I used to go, I used to make like house calls, I guess, but
Yeah.
just do it in the client's house. So
Okay.
yeah, they have they'll put ads everywhere.
But now that you see, and it's funny you mentioned that because that's exactly the kind of projects I'm gonna be working on,
Mhm.
hopefully with like universities and stuff,
Okay.
which I was telling you about, and you too, you guys will help for that.
Yeah.
But you see now that you're working here, how those guys have like potential, but they don't even know what research is.
That it is. Well, yeah. I mean, now that
You
you
can connect
say it
those
like
dots,
that,
right?
Yeah, because well, the guy that I was working for, he was in it like just as long as you've been in clinical, like 15 years. Like he started out of his house.
Yeah.
He bought a little space, whatever, grew it up, and I guess that's his end goal. So he's not really looking for anything
Right.
bigger, maybe just a scale in terms of size, but nothing like research wise.
Right.
But I do see the dots that you throw out there because I mean,
Yeah.
it's just kind
And
of
that's one of the things I was telling James, like you can connect the dots.
you have to have that open mind or see like, is there something more? How can I do this?
Everything,
Yeah.
like even all this stuff we wrote on the board.
Oh,
like,
yeah.
all those things are connected to everything,
Yeah, they are.
right?
And every time I come in here, there's always something new. But I mean, it's always generally the same thing, just with a different outline. So I mean, yeah.
And every student, like I put these videos on YouTube every time, and it's never the same thing.
No, it's always different or new or something.
Mhm.
So
They're
Yeah.
just connecting different dots.
yeah.
All right. Anything else, Chris?
Yeah.
You want to talk about soccer, Jordan Peterson?
Oh yeah,
The-
love soccer.
The French.
Love them.
The French?
Love them too.
The French.
Two things I
They're,
love you guys are mentioning.
they're your
All the
favorite.
games.
Yeah. Oh, you like that too. Jordan Peterson.
Yeah.
Okay.
Beautiful.
All right. That's it. Anything else, Kobe? James?
No, I think I'm good. James.
We're good. We are good to go. Thank you, everybody, for listening, watching, and we'll catch you all later. Bye-bye.